Welcome to Your Eye Show. I'm your host, optometrist Dr. Ed Wallington, and today I'm going to help you understand what to expect when you're on your road to your cataract surgery day and the day of your cataract surgery. I'm not going to do this myself, though. I'm going to hand it off to a patient of mine who actually is just recently experienced this. He's actually going to share with you his journey from when he recognized he had a problem all the way up to the day of cataract surgery. When I say the day of, he's actually sharing his story with you about 6 hours after he had cataract surgery. Okay, you'll actually see he actually has an eye shield on that you get after cataract surgery to, so you don't accidentally rub your eye or get your eye poked during those crucial, that first 24 hours after cataract surgery to let the eye heal a bit before you expose it. He actually does an amazing job at it. He's very articulate in how he explains the detail of the step-by-step. A great speaker. He's actually my parish priest, Reverend James Kean from St. Joseph's Catholic Church in Lake Orion, Michigan. And the doctor that we sent him to is Dr. Arthur Tatge. So Dr. Tatge is out of Lapeer, Michigan, an amazing ophthalmologist. If I can trust my parish priest to Dr. Tatge, I got to have a lot of faith in this guy, right? Matter of fact, I actually sent my mother to Dr. Tatge too. And that would be my only tip really for your cataract surgery is when you go to your optometrist, your optometrist is going to refer you out. Ask your optometrist, who did you send your mother to, or who would you send your mother to, or your parish priest to for cataract surgery? And whoever they would send, even if you have to drive an extra half hour to go there, find your Dr. Tatge out there, the doctor that your optometrist trusts with their family and their loved ones in hand. So without further ado, let me hand you off and let Father Jim share his story.
The initial roots of me recognizing that I had a problem with my right eye really began the last few appointments I had with eye doctors. I was getting prescriptions for my eyes, and I was aware that the right lens was not fully correcting what was going on in my eye. And I did have one of the optometrists said, "Oh, it looks like you have a cataract starting to begin, but it's not a very big one. It's no big deal." And so I didn't give much attention to it. But I was becoming aware with the last couple of prescriptions that even though my left eye, I'd walk out of the optometrist with a set of glasses that perfectly fixed my vision of my left eye, my right eye was just a little bit off. And the last prescription I got just a few years ago, I noticed it even more. So much so that I even brought it up to the optometrist, and that optometrist at that time wasn't real receptive, or he just didn't make the connection. He had told me too, it's like, you got a cataract starting. Over the course of the next couple of years, the effect of the cataract became really pronounced. The corrective lens that I had in place was not doing the job. That my vision in my right eye was declining quite considerably, and I didn't know what was going on or why it was getting so bad. I thought it was just being lazy and getting out of shape. And so when I met Dr. Wallington and described a little bit of what I was going on, he said, "Well, come in and he'll take a look at the eye and see what's going on." Immediately, he saw the root of the problem was the cataract that had now progressed quite a bit and was causing all these other problems. So that was a great consolation to me that there was a solution to what was going on in my eye to cause this decline of vision, which realistically speaking was quite rapid. I've worn glasses to correct my nearsightedness since I was in high school. But these last 3 years, and now in my late 50s, these last 3 years, it was just too fast of a change for it to be explained by just declining vision. So when Dr. Wallington gave me the prognosis that it was the cataract behind all those problems with my right eye, it was a relief to be able to say, "Oh, so this is something that we can fix." And he was very, very affirming of that reality. And then he was also, very clear in walking me through the steps of like, this is what's going to happen with a cataract. I try to be very receptive to all the information he was giving me, so much so that we thought that the idea of this video would be a helpful thing. Just as, I found it very helpful to respond to the information that was given to me and growing confidence with the idea of getting a cataract surgery. So too, the idea of providing a little bit of testimony and experience we hope can be helpful for others who may find themselves in similar situation where they have a rapid decline of vision that can be attributed to a cataract behind all the problems. So I made the visit with Dr. Wallington in early November, and then he gave me some paperwork and set me up so that I would go visit Dr. Tatge. And from that point, it was about a week later, making communication, setting up the visit, that I was able to make my visit with Dr. Tatge. And it's a large building. You go into the main entrance is very clearly identifiable, and then you come into the lobby and you veer to the right and go down the hallway off to the right, and you go past the pharmacy that is there, and then shortly past the pharmacy, that's where you'll run into Dr. Tatge's office. There's a couple of names that are on the nameplate there, so you'll find him amongst the other three people who are part of the building. And so you enter into his office right there by the nameplate, and you check in like you normally would at the kiosk that says it's Dr. Tatge's office, and that's where I had my second appointment. For there, meeting with Dr. Tatge, he's going to look at my eye, he's going to find out my history, just as Dr. Wallington did. For example, in my case, I had LASIX about 20 years ago, and that's one of the factors that they're going to want to know as they prepare your eye for the examination. And Dr. Tatge verified, the nature of my cataract. It definitely was something that needed surgery intervention. And then he used his equipment to determine the lens that would then replace the cataract after it was removed. And so went through all that, along with the paperwork that Dr. Wallington had given me to get me ready for this future surgery. Then Dr. Tatge also provided me with more information of things that I would need to do to be ready for that surgery. The surgery was about 3 weeks later. But quite often it's like a month or so, but I was able to get in a little bit ahead of the time frame of the full month, and so that brought me to the first full week of December when I had my surgery for my eye. So I went from early November to having my surgery done by the end of the first week in December, so a little over a month's time frame. The next phase for getting ready for a cataract surgery is those very crucial days before you go in for the surgery itself. And you will have already been given directions by the optometrist and the surgeon, Dr. Wallington and Dr. Tatge, so that you're well prepared to know what you need to do there. And then you receive, in addition, a phone call to walk you through some of the more immediate procedures that happen prior to the day of the surgery. And what those would require, for example, you start putting drops into your eyes, and you just follow the directions. A very easy to follow sheet that will tell you the kinds of drops that you would put in your eye as a way to get prepared for the surgery. And then the phone call that you're going to receive from someone on the surgical team will give you all kinds of good advice. Simple things like when you do your morning shower that day, you would want to be using antibacterial soap. So in my case, I had to go out and buy some antibacterial soap to be ready for that early morning routine. They tell you about eating, and there's different restrictions about eating. You do have to fast at least 8 hours beforehand. I did my fast for my surgery midnight the day before. And so that's something too you want to factor in. It's like, okay, I'm going to have to fast and know how can I do that. In my case, again, since it was midnight, I had to begin my fast. I woke up that night and had a late night meal in order to be ready for that, and not be too hungry or worry about sugar levels or anything like that. So that's another thing that you would have on that pre phone call that helps you out with the things. They give you other advice, like I'm wearing the clothes now that I wore to the doctor's office, And so one of the directions was loose fitting, so I could take them off and put them back on, because you will wear a gown that you use to go into the surgery room rather than your street clothes. Street clothes go into a bag, and that's there. Obviously, they'll remind, and they want to make sure you know who's driving you there. And I had one person drive me to the hospital, and then I had family members who met me there. It would be good that they're with you throughout, because when you go into the hospital, you check in like you normally would. They give you the identification badge. You go to a waiting room, and then from the waiting room, you check in at the waiting room, and they call you up so that you go to the pre-operation room, and then you go back there. Now, and at that point in time, the people I had who were going to be there for transporting me home hadn't quite arrived. So I had it's cold outside, so I had a heavy coat. It would be good to have the people in the waiting room take all that stuff from you, so you could turn that over to them. And there's two places that Dr. Tatge will be doing his surgeries. You either will be doing it at Lapeer Hospital, that's run by McLaren, or also at the Lapeer County Surgical Center, both excellent facilities. When you come in, for my part, instead of going to the Lapeer County Surgical Center, I went to the Lapeer Hospital. And so when you come into there, you come in off of Lapeer Road. You drive in as you come into the hospital. You'll see the large pavilion where the drop-off is for patients coming in, and you can either park or have someone drop you off to take you into the desk. And so once you walk in, being a little on the smaller side as a hospital, you walk right into the information desk that is right there inside the doors. They'll direct you to be seated by the intake area, which is off to your left as you come into the hospital. And it's from there that you're received, and you meet with someone who does the intake and gives you your little medical band and gets you in the system. Then shortly thereafter, you're invited to go to the waiting room. You go into the waiting room an hour, 2 hours in advance. And in that time frame, they then do a couple of things. They'll give you a pick so that they can start an IV. And I had a saline solution going on while I was sitting in the pre-op room, and then they walk you through a set of drops that go in the eyes and getting your eyes prepared. And they're numerous drops. They did them 4 times, but they'll walk you through it. And the nurse takes care of all those drops as they walk you through it. They warn you, like one of the drops, ironically, the one to numb the eyes has a tendency to burn. So they'll tell you, okay, this drop is going to burn a little bit, and so they keep you prepared for it. The nurse does an amazing job of applying the drops, and then you let them soak in. And you wait your turn. And then the surgery comes up. They prep you from that point by putting you on the gurney. You take you into the gurney. The nurses, the staff, they're wonderfully sympathetic, and they're always making sure you're the person that you say you are. They ask numerous times, which eye are you going to have surgery on? And in my case, it's the right eye. And you can see, actually, even over the patch that I have, there's a marking that they made to indicate this is the eye that they're going to work on. And the surgeon himself makes a visit in the holding area right before you go into the surgery room. And he'll walk through the same set of questions. And even he made a little bit of a mark on the bottom of my eye so that it was his own identification. This is the eye that they were going to work on today. So that gives you a lot of confidence, I think, about they do a very professional. They're very exacting. They're not going to make any mistakes going in. They explain things very thoroughly. You do get an anesthetic, and the anesthesiologist will come in, and she explained to me exactly how that was going to work. And then when I got into the surgery room, they prep me. They secure you on the gurney, and they make sure that you're in a position comfortable. But then they also make sure you don't move and squirm, because you're in what's called a twilight anesthesia. And what that means is you have awareness. I had an awareness of what was going around me. But the twilight anesthesia, the greatest effect there is it put me into a condition where I just didn't care about anything. I was just kind of floating along. I was aware that the surgery was going on a little bit, but I just didn't care. And so there was no temptation for me to want to flinch, move, or even wrestle, because you're a bit restrained in order to keep everything nice and stable for the surgery. But the effect of the anesthetic is to allow the person to be awake, semi-conscious, because I could answer questions and everything like that, but I just didn't have any awareness of time or awareness of the particulars of what they were doing. Generally, was aware of what they were doing. They give you the anesthetic while you're in that position, getting ready. They put a cuff on you for reading your blood pressure, so that's there. The PICC line that they had, the saline solution, is what they used to introduce the anesthetic. And so as all that's flowing along, they cover your face so that your face is covered with only the right eye that's going to be worked on was left open. And then when they come in, I don't even remember the transition of when that took place, but I do remember the machine over my eye and them working on it. And there was an occasional question to me, but again, I'm under the anesthetic, and the time frame of how it works, it only takes like 10 minutes, but I had no recollection of time. I would have said, if someone asked me, I thought it took 2 minutes. So after the surgery is complete, they remove it. They say, "Yep, there you go. It's the surgery, your cataract is removed." They pull away the machine. Then you're transported out, and they make sure you're okay, and they move you back to the room. You're joined back with the people who are waiting there for you. They've been given instructions, and they've been given advice about what needs to happen. And so you have someone who transports you and takes you home, because this anesthetic, you cannot drive, so you have to have a driver there. And after having the anesthetic, I wouldn't want to be driving under those conditions. And then you also want that other person to be aware of the directions that are given to you immediately. Like your first visits, you're given plenty of clear documentation and clear instructions of what you will be doing in the next few days. But it's always very helpful to have someone who's been given the most immediate and particular instructions. So those were relayed to me as the anesthetic wore off, and the basics about what you're not supposed to do. I keep this patch on for my eye for 24 hours. I have a follow-up visit the next day to inspect the eye, and then the patch would come off. I was told, or my family was told immediately, that the cataract surgery was a success. There is a follow-up phone call in the evening, which I received around dinner time, from the doctor. Dr. Tatge called me up and congratulated me and said everything went very well, and reminded me of the appointment that I have the following day, which is normative under these experiences. So now I'm in that position where I just have to be mindful of my eye. I sleep like on my back or on the non-operational side. I can sleep on my left side, but my right side, I can't sleep on that. So to accommodate, I'm going to sleep tonight in a recliner chair. So I can't flip over and sleep on my belly. That's one of the postures they would not want you to sleep in. They don't want you, they remind you not to rub your eyes, and be very cautious about that. Not to lift up anything heavy or do any bending over. They wouldn't want you to be bending over. So these are the kinds of instructions that are said not just once, but multiple times in different ways, so that you're protected to be able to have the best chance of quick recovery with your eye and the new lens that's been placed in my eye. So those are the immediate things that I'm looking at. As I said, I'm day one. The surgery was earlier this afternoon. It's now the evening of that day. Tomorrow morning, I have my follow-up visit. And then in a week after that, I will have another visit where I see the surgeon. And then a month later, I go back and I see the optometrist who has provided me the initial care for this whole procedure. The great thing about cataract surgeries is they keep you well informed all the way throughout. None of the steps that are there are terribly invasive, but they are things that obviously you have to think about. There are things that you do have to plan for, such as fasting prior to the event as well. So that's the basics of what I would share about my surgery experience. I hope for those who have had the experience or are thinking about it, that what I share can help them to realize that this is very doable for someone to go into the hospital and see their optometrist and optical surgeons and be able to work with them to be able to resolve this situation. Even now, as I have the patch on, I am getting light through there. I do have a sense if I hold cover one of my eye, I can see basically a little bit through the lens that is on there. So I do know my eye works, which is kind of encouraging. So I greatly look forward to the visit that I'm going to have tomorrow when the patch comes off and I can see the full effect of the new lens being in my eye and the cataract being removed. So that's something to look forward to as well.
So to follow this up, that was actually on Thursday that Father Jim actually had his surgery, and it's right now it's Saturday night, and I actually just went to Mass and seen Father Jim for the first time. For me to see him do Mass without his glasses on. Okay, so this little video is me walking up to him afterward, and he wanted me to share with you. Just right after I took this video here, he said, "Hey, I wanted to tell you when I took my shield off that my eye stung, and I wanted to share that with everybody. You know, when that wind hit it stung, and I want them to know." So he wanted me to share that with you. There you go. And you'll also maybe notice that in this video, his pupil is real small. So during those first few days after cataract surgery, they put some drops in there that will make your pupils really small, and that will last for a while. But that's on purpose. So once they get that lens in there, they don't want it popping out or moving, so they bring that lens down real small and keep the fluid flowing real nicely in your eye, okay? So thank you very much for coming, and we will actually have another follow-up video about a month from now to just kind of wrap it up and let Father Jim kind of update you on the post-cataract experience about 30 days or so after the surgery to let you know how it all turned out, okay? So thank you very much. Thanks for watching Your Eye Show. We'll see you soon.